Washington Journal continues.
Welcome back. We're joined now by Sophia Tripoli, who is the Health Policy Senior Director at Families USA, and she's here to talk about the GOP tax and spending bill and how they'll affect health care programs. Welcome to Washington Journal.
Thank you very much. Thanks for having me.
Can you talk a bit about Families USA, what you all do, who funds you, and any ideological position you have?
Absolutely. Families USA is a nonpartisan healthcare organization. We work to make sure that every person living in the country has access to high-quality, affordable health care and the health that everybody deserves. We have been in existence for more than 40 years, working here in Capitol Hill and also with partners across the country and across all states, working to forward our same exact mission around the most affordable health care and best health for everybody.
And how are you funded?
We are funded primarily through philanthropy, and through grants and programmatic work.
Now, let's get some baseline information about who is covered by government health care programs. We've got some data on that from the Centers for Medicare and Medicaid Services that more than 72 million adults are enrolled in Medicaid. Nearly 7.3 million minors are covered by the Children's Health Insurance Program, and then ACA Marketplace insurance plans covered more than 24 million people last year. Now then, when we look at the House and spending, the tax and spending bill that was passed by the House, according to the Congressional Budget Office, it would make some significant changes that would have some knock-on effects for these health care programs, including almost 11 million people would become uninsured over the next decade, according to that CBO estimate. 7.8 million would lose Medicaid coverage due to more stricter work requirements and more frequent eligibility checks. And then it includes 1.4 million people that would lose their insurance coverage because they don't have verified citizenship and would lose coverage under those programs because of changes in the legislation. Another 5 million would become uninsured from a combination of expiring Affordable Care Act subsidies and a new ACA rule. And then federal spending on Medicaid and the ACA would be reduced by $902 billion over a decade. So can you sort of help us understand what's in this legislation and why it would have such a strong impact on America's healthcare programs?
Absolutely, and I think your numbers really speak volumes. Those numbers coming from the nonpartisan Congressional Budget Office that has analyzed this legislation, and really the numbers don't lie. This bill, taken together on healthcare, would cut more than $1 trillion from healthcare programs, including the numbers you outlined on Medicaid and the Affordable Care Act. And the bill actually also triggers a cut to Medicare because of the increase in the deficit spending that the bill would have. And so it triggers an automatic $500 billion cut to Medicare as well. And so ultimately what this is 16 million people at risk for losing their health care if this goes into effect. And we're talking about low-income people with disabilities, low-income seniors, children, working adults, all at risk for losing their health insurance if this bill moves forward and is enacted into law.
Let's talk a bit more about Medicaid specifically, because this is the program that's been getting a lot of attention in relation to this legislation. What are the current eligibility requirements and who's using Medicaid?
Absolutely. Medicaid is a program for low-income individuals, low-income adults and children, seniors, people with disability, and there are a number of factors that are used to determine whether somebody's eligible for Medicaid, and all of that is set in federal law. And the people who rely on this program are people in our communities, seniors who rely on Medicaid for paying long-term service cares and support so that they can get nursing home care. It's veterans who are low income. It's children who live in families who have low income. It is people in our communities who rely on Medicaid as a health insurance program, who have no other option to buy or purchase affordable health care.
I'm looking at some data from the Georgetown Center on Poverty and Inequality, and they talk about people participating in both SNAP and Medicaid make generally an average of about $30,000 a year. There's been a lot of complaints, though, that this program, Republicans have complained that there are a lot of people using this program who shouldn't be, whether they be undocumented immigrants or there's been a lot of talk about young, able-bodied people. How real is that?
I think those are, it's a bit of fear mongering, to be honest. And I think when we look at these programs, I think the people who have Medicaid are eligible for Medicaid under current federal and state law. And so when we look at the program, you know, the fact of the matter is that there is this rhetoric around able-bodied folks who are just kind of pulling benefits down from the system and don't belong to be there. But more than 92% of people who rely on Medicaid for health insurance are working or have an exception for because they're a person with a disability or they're a full-time caregiver. And so a lot of the requirements in this bill are about attacking, sort of using rhetoric to attack people's access to healthcare who need the program, who belong there, who are eligible for the program under current rules.
Right. So this legislation for the first time imposes a national work requirement on the Medicaid program. Already some states have programs like this. It would require people, certain individuals covered by Medicaid, to work at least 80 hours a month or potentially engage in community service work or training or be enrolled in school. What evidence do we have that work requirements on Medicaid actually encourage more people to find work?
Very, very little evidence, and I would say almost no evidence that work requirements in Medicaid actually result in more work. Again, that stat of 92% of folks in Medicaid are working already or have an exemption because they're a caregiver or a person with a disability and can't work. And we've actually seen states try to implement work requirements. Arkansas, for example, a few years back under the first Trump administration. And we know that work requirements are just about creating red tape. It's just about creating hoops for folks to go through. It's, you know, these folks are already working and now they have to demonstrate every month that they're working. And in states like Arkansas who tried this, we saw 18,000 people lose their healthcare coverage just in the first 7 months that the program was operating, costing the state $24 million. These are very expensive burdens to place on states, and it's just about creating more paperwork burdens to put low-income individuals through just to justify and prove to the government that they're working when in fact they are.
Last Wednesday on Fox Business Network's Kudlow, Centers for Medicare and Medicaid Services Administrator Dr. Mehmet Oz discussed why he thinks work requirements are necessary and beneficial for Medicaid recipients. Let's listen to this and I'll get your response.
Well, just to reiterate, there is no scenario in which we do not spend more money on Medicaid than we spent last year. So the question is how much more money and how do we save Medicaid so it doesn't continue to grow 50% every 5 years, which is what happened. So if you go back in history and look at other programs that are similar, they're support programs like food stamps, which is the SNAP program, or TANF, which is temporary assistance to needy families. They have work requirements. Now, why don't we have work requirements for Medicaid? Well, the reason is 60 years ago, when the program was created, it never dawned on anybody that able-bodied people who could work would be on Medicaid, so they never bothered putting in work requirements. We're asking that able-bodied individuals who are able to go back to work at least try to get a job or volunteer or take care of a loved one who needs help or go back into school. Do something to show you have agency over your future. And if you're willing to do any of those things, we will check the box and you get to keep your free Medicaid. But if you're not willing to do those things, then we're going to ask you to go on and do something else, like go on the exchanges or get a job and get into regular commercial insurance. But we're not going to continue to pay for Medicaid for those audiences. And I think that is a very realistic effort. And it's been done in the past, actually under the Clinton administration, when they reformed the temporary assistance for needy families. They did it and they showed a dramatic 15% increase in workforce participation amongst those people. So Democratic presidents, Republican presidents have all felt that work was an important part of the deal with America, and we're just acting on that reality.
Sophia Tripoli of Families USA, what did you think of that?
Well, I think we can all agree, and I think every American knows that the healthcare system is too expensive, that care costs too much. It's incredibly complicated and burdensome to navigate the system, and people are frustrated. But I don't think the solution to that is to create bureaucratic burdens, force people to submit unnecessary paperwork, and just to appease some rhetoric. I think the reality is that the Medicaid work requirement programs are inefficient. They don't work. They make it more difficult for people to get coverage and to stay insured. And we know that the numbers don't lie. The Congressional Budget Office is telling us that nearly 8 million people for Medicaid will lose coverage because of many of the provisions in this bill. And so I think that again, the vast majority of people on Medicaid are already working. or they have an exemption. And so this idea that these are able-bodied folks who don't belong to be there is just simply not true.
If you have questions for Sophia Tripoli, you can call us Republicans at 202-748-8001, Democrats at 202-748-8000, and Independents at 202-748-8002. And we've talked quite a bit about Medicaid. I want to ask you about some of the other programs that could be affected by the GOP's tax and spending bill. What about the Children's Health Insurance Program?
Yes, absolutely. I think the cuts that we're seeing in this bill will have impact for Medicaid and CHIP. One of the biggest impacts for the CHIP program is that it actually, this law, if it were to go into effect, would pull back a rule that was finalized under the Biden administration, a federal law that would actually make it easier for low-income children to get enrolled and stay enrolled into CHIP. And so this bill would actually pull that back and make it much more difficult for low-income children to get health care, in addition to the fact that it also pulls back rules for improving eligibility and enrollment for adults, and all the other attacks on the adult population of Medicaid taken together. It have a significant impact for children. About 1 million children could be at risk for losing their health insurance just from the pulling back of this one particular rule that would make it easier for them to get enrolled.
And what changes would the bill make to, say, the Obamacare exchanges or the Affordable Care Act exchanges?
There are a number of very technical changes that this bill would make to the ACA exchanges for people who purchase their health insurance directly from the federal state marketplaces. And the effect of them all is that it reduces benefits, it increases cost sharing, meaning people will have to pay more money. And it makes it much more difficult for people to get enrolled and stay enrolled, getting rid of a lot of the processes that actually made the system much more efficient, streamlining enrollment and eligibility, making it easier for people to get into the health insurance through the ACA marketplace. This rule would pull all of that back by design to make it more difficult for people to access their health insurance, because the goal is, again, to force people off of health care.
Some lawmakers as well as advocates have raised concerns about the impact this legislation as written could have on rural hospitals and rural patients in particular. Why would they feel a more significant impact than other groups?
It's a great question and really important. I think one of the provisions that this bill would do is it attacks one of the mechanisms that states use to generate the revenue that they need to pay for Medicaid services. Medicaid is funded both from a federal partnership with federal state partnership. And so it attacks this tool that states have. And of course, the result of that is that it means that there's less resources coming into the state. Medicaid is one of the biggest funders, sources of federal funding coming into states. So what that means for hospitals is that you have revenue that's all of a sudden not coming in directly back into the system. And so there are some estimates I've seen that predict that about, for rural hospitals, 20% of their operating margins could be reduced pretty significantly. For many of those rural institutions, it means they'll likely have to shut their doors. For those communities, it means you don't have access to care. You've got to travel farther distance to get care, like primary care and pregnancy-related care, or care for your kids, care for seniors. And so it has a significant impact on rural communities and hospitals broadly, but in particular, I think rural hospitals at very high risk if this bill goes into effect.
These changes that will result in some of these estimates that the CBO has put out are effectively to help pay for the extension of the 2017 Tax Cuts and Jobs Act, individual tax cuts, along with some other initiatives the Republicans put in this legislation, as well as the Republicans say, to cut back on waste, fraud, and abuse. What do you think of this trade-off?
Well, I think at the end of the day, it's a bit of a kicker that this bill is about forcing 16 million people to lose their health insurance, threatening state economies and healthcare system, sustainability of those systems, just to fund tax breaks for big corporations and billionaires. That's the trade-off. And I think as far as fraud, waste, and abuse, I think the data shows us that there's very, very little fraud or abuse in the Medicaid program. Less than 1% from of Medicaid beneficiaries actually in that bucket. And I think there's often some numbers thrown around about improper payments. And the reality is those improper payments account for only 5% of Medicaid billing, and actually are errors, because you've got a doctor or a nurse making a mistake on a billing code, or a health plan who makes a mistake. And so I think the fraud, waste, and abuse is blown out of proportion as a way to justify cuts, because at the end of the day, this bill is happening, the negotiations around what happened in the House was all behind closed door. They don't want constituents, they don't want your viewers to know that it's going to result in 16 million people losing health insurance. That's why it's been very sort of backdoor dealing about the provisions in the bill and what the impact will be on people, because it's not good. And the numbers, again, don't lie. We see the numbers from the Congressional Budget Office, the independent agency telling us exactly what the impact of this legislation will be on people.
Let's get to your questions. Our phone lines again for Republicans, 202-748-8001, for Democrats, 202-748-8000, and for Independents, 202-748-8002. We'll start with Michael in Richmond, Indiana, on our line for Republicans. Good morning, Michael. You're on with Sophia Tripoli.
Yes, ma'am. My name's Michael. I'm 56 years old. I had to quit working in 2021. I went on Social Security disability, and I am on Medicaid. Well, I'm on 12 different types of medication. I got diabetes, Parkinson's, hardly walk half the time. And, with these work requirements coming out, well, my question is, if I have to go to work, I'm at the doctor about 4 times a week. I got 11 different specialists plus a family doctor. Who's going to hire me? Because I'll be at the doctor most of the time. There's no job going to hire me if I'm at the doctor all the time. So, I don't know how that's going to work out. So,
Michael, thank you so much for that question, and I think your experience is exactly the point, right? Is that you have a very good reason for your circumstances, and these programs are not thinking about what it's going to be like for an individual like yourself to have to go through the hoops to either prove to your state government that you have an exemption, or prove to your state government that you are working the minimum hours required that would be under this law. So it will be extremely difficult, and I'd encourage you to share, if you haven't already, to share your thoughts about your personal experiences with the lawmakers in your state, to help them understand what the real life impact of this bill would have for yourself and people who have similar circumstances to you.
And just to sort of give people an update on where this is, this version of the legislation that we're talking about is the version that was passed by the House. The Senate's looking at it now. The Senate will make its own version that they'll vote on, and then the House and the Senate would have to come together to pass something.
That's exactly right. The House already passed this out, and now the Senate is negotiating over the provisions. I think we're waiting to see some of those initial what some of those negotiations yield on the healthcare programs. We expect potentially next week we could see some initial text, but whatever comes out from the House will have to be reconciled with from the Senate will have to be reconciled with the House, and so there's still a bit more here until we know how exactly this bill will move forward.
Although it is important that the way that this bill is structured, it doesn't take 60 votes in the Senate, it would only take a simple majority.
Correct.
Okay, let's hear from Mark in Dayton, Ohio, on our line for Independence. Good morning, Mark. Go ahead, Mark. You're on with us in Washington Journal.
Yeah, thank you. I greatly appreciate the opportunity to put in a question. I just wanted to make a comment. The C-SPAN is quite a impressive show to watch on these matters. And in the terms of Medicare and Medicaid, and all the expenses we incur, I happen to be a physician, and I just wanted to ask, a perspective of mine is that, that we do pay a great deal of taxes, in the United States for these services, and I think certainly physicians feel that everyone should have a right to care, and I certainly feel that way many times from non-payers. I don't really care, frankly, if we always, make money for our care, but that being said, there is concern, in my view, anecdotally, rather a long period of experience taking care of patients, where there are many patients who really, in my view, can work and aren't doing a fair part in their efforts in society, younger ones, and maybe get on disability for maybe not such great valid reasons, from a physician perspective. And we have this rising cost in our budget. And this is a big element. What's the answer to that when we have these bills that we can just criticize because someone like the last caller can say he's disabled, and I agree he is, but how do we discriminate between those who are genuinely disabled and not? Don't we have to have some regulation on this point?
Mark, thank you so much for the question. I think it's a really important one. And I would say to you, look, the system is complicated, and I think this legislation could be focused on making the system more efficient. It could be focused on actually improving some of the processes and addressing some of the underlying drivers of what makes care so unaffordable and the cost of care increase year after year. It could be focused on reducing the complexity of the system and making it easier for individuals to navigate the programs. But that's not what it's doing. This bill is about making it much more difficult for people who are eligible for Medicaid to stay eligible, or eligible for the ACA marketplaces to stay eligible, and so forcing them to terminate their coverage and to fall off. And I think to your point about individuals and working, I think again, like the data shows us that the vast majority of folks who rely on Medicaid for health insurance are already working, or they have an exemption because they are a person with disabilities, they are a full-time caregiver, or they're a student. And so there are checks and balances in place already to make sure that the folks who are eligible for Medicaid are on Medicaid and get to stay on Medicaid. But I appreciate your concern, and I and understand where you're coming from on that. It is a challenging balance to strike.
Healthcare policy organization KFF has some polling on who's using Medicaid and the ACA marketplace. I just want to read a little bit here. Millions of adults who get health insurance from Medicaid and the ACA marketplaces across the political spectrum are at risk of losing coverage if the current version of the reconciliation bill becomes law. While most Medicaid beneficiaries under the age of 65 are Democrats or lean Democratic, 37%, or do not lean towards either party, 36%, more than 1 in 4 are Republicans or lean that way, including 1 in 5, 19%, who identify as MAGA supporters, President Trump's strongest base of support. Republicans also make up 45% of adults who purchase their own health insurance, most of whom do so through the ACA marketplaces, including about 3 in 10, 31%, who identify with the MAGA movement. About 1/3, 35%, are Democrats or lean that way, and 1 in 5 do not identify or lean towards either political party. And here's a graph showing that, and this is again looking at people aged 18 to 64 enrolled in either the ACA marketplace healthcare plans or Medicaid. So the distribution of these programs goes across the political spectrum.
Yes, absolutely. I mean, the thing about health and healthcare is that it doesn't see political parties, right? I mean, everybody, whether you're Republican, Democrat, or anything in between, or other, needs access to healthcare, affordable healthcare that's high quality, so they can get the care they need at a price that they can afford. And that's exactly what these programs are designed to do.
Dave is in Armstrong Creek, Wisconsin, on our line for Democrats. Good morning, Dave.
Yeah, thanks for taking my call. Our healthcare system is a mix of, private insurance, Medicare, Medicaid, veterans insurance. It's very expensive. It's more expensive than any other place in the world for the type of country we are. It seems to me that, the less people that are on insurance, some kind of insurance, they're just going to go to the emergency room. We can't deny people coverage at the emergency room, but that's just going to make it more expensive for everybody else. So, my solution would be some type of a universal care system. We should be able to figure that out. It's just there's no political will to do it. It'd probably be cheaper, more efficient, with less paperwork and administrative stuff involved. So that's my view of it. And, as far as kicking people off insurance for whatever reason they can come up with, basically it's just going to end up making it more expensive for everybody else. So that's my point.
Dave, thank you so much for the question. I think you're exactly right. When people lose their health insurance, they delay care, they skip care altogether until they're sicker and sicker, and then they show up in the emergency room when they're much, much sicker and need much more costly intervention to treat the illness that they're dealing with. And those emergency departments, those hospitals and health systems end up being overwhelmed and have to absorb all the additional individuals who don't have insurance and haven't gotten that preventive care that you've talked about, haven't been able to see their doctor far in advance of that emergency room visit to help them manage their heart disease or their diabetes, or to make sure that they can get access to their medications to treat their asthma or whatever the illness or condition might be that they're dealing with. So I think you're absolutely right. When folks are uninsured, the emergency room the hospitals absorb a lot of those costs, and it's extremely expensive. It's the most expensive care in the country. And I think you raise a really important point, which is that healthcare is very expensive in this country. And this bill could be focused on actually addressing the underlying drivers of why our premiums go up every month, why our out-of-pocket costs go up every month. But it's not. It's focused on creating red tape, making it more difficult for people to get enrolled, to force people off coverage for those tax breaks for the billionaires, big corporations. But it could be focused on making the system work better. It could be focused on addressing the fact that we see, big healthcare corporations sucking up more and more power so they can just increase our prices and our premiums year after year with no oversight, something that has had bipartisan support from both Republicans and Democrats in the past, but we haven't actually seen this Congress being able to take that up or those priorities articulated in the context of this bill. Thank you.
Mary is in Newport, Rhode Island on our line for Independence. Good morning, Mary. Oh, I guess we lost Mary there. Let's hear from Crystal in Hillsdale, Michigan on our line for Republicans. Good morning, Crystal.
Hello.
Hi there. You're on with Sophia Tripoli of Families USA.
Hi. Out here in the real world, there is a lot of scam going on. I have had people ask me to buy their food stamps, okay? So you can't tell me it's not going on. I've seen people in the parking lots pouring out cans of pop to get the deposit here because our deposit is 10 cents for each can. Okay? So, I mean, if you're going to let them, let them have what they want, but make them pay their own deposit if they're going to do things like that, As far as health care, do you know if I, as an insured person, go to a clinic and use my insurance, it costs me $75 to $100 more than a person that walks in without insurance? Why is that?
I think I can't speak to the specific circumstances of your insurance benefits or sort of what your arrangement is, but I think ultimately what you're pointing out is actually a very big challenge in the healthcare system, which sometimes to pay out of pocket without insurance, healthcare costs less than to pay through your insurance provider. And that is getting to that point that I sort of mentioned in response to the last caller about what are some of the underlying reasons why healthcare is so expensive in this country. And it's not because too many people are in the program. It's because we have these, we've seen this incredible proliferation and growth of corporate health systems that are finding all the different ways to identify loopholes and game the system and making that part of their business model. And the business model is about how do I increase prices as fast as I can. And I would say that's probably the underlying reason why you're seeing such a price differential. And there's been attempts, including from the current president and his last administration, to increase the transparency of what the prices are that people have for insurance for exactly that reason, because there is so much variation in what people are paying. And we have to get our arms around that as a healthcare system.
We have a text from Judith in Newark, Delaware, who's an independent, and says, as a medical resident in Florida, I cared for many women who flew to Florida from other countries in the late stages of pregnancy to facilitate delivery, with the result being an infant with U.S. citizenship. Medicaid paid for their care and the care of the infant. The infant would return to the country of origin to return later in life as a U.S. citizen. Can the guest comment on whether this is an appropriate use of Medicaid?
So I can't comment on those specific circumstances, but what I can tell you is that for individuals who without documentation, so undocumented individuals, they are already prohibited under federal law from having access to federally funded healthcare programs. There are some lawfully present individuals, such as green card holders or people with working visas, that are able to be eligible or qualify for some healthcare programs, including Medicaid, after what's referred to as a 5-year waiting period. And so those are already federal laws on the books. It's very rigorous. But the bill that we're talking about here today, the Big Beautiful Bill Act, would make it so that many folks who are lawfully present would actually lose their access to health coverage. It also takes it one step further, and in some of these instances, states are able to determine that they want to use their own state dollars, so not federal dollars, but their own state dollars to extend benefits to certain individuals based on the state decision, which they have the authority to do. And what this bill would do is actually penalize the states that have done that by taking away some of their federal money to help fund their Medicaid program. And so I think those specific circumstances I can't speak directly to, but I do know that it's that those are the current federal laws around immigrant health care.
John is in Hickory Flat, Mississippi, on our line for Democrats. Good morning, John.
Yes, I got a question. They're talking about work requirements. So I've been on Medicare and disability and stuff since 2012. But I worked since I was 15 years old. I'm totally blind now. So is there going to be work requirements for me? And is they going to mess with my Social Security?
So I think the work requirement provisions are specifically for states who've expanded Medicaid. I believe you said you're from Mississippi. So those provisions would not be applicable to you in Mississippi, but there will be other impacts of the program that potentially could affect you and others in Mississippi. But it will be these provisions around work requirements are specifically targeted to 10 states. So that's 41 states, including the District of Columbia, who have expanded Medicaid, and it targets the folks who rely on Medicaid in the expansion population.
Rodney is in Elgin, Texas, on our line for Independence. Good morning, Rodney.
Good morning. Thank you for taking my call. Your guest states that she doesn't think or the system is not designed for. But, things could be changed. Under the Affordable Care Act, which is a law, able-bodied people can be on it. Okay? You got 20 million people that over the last 4 years came into this country. They need housing. They need education. They need jobs. They need medical costs. Where do you think this stuff is coming from? It's coming from these programs that are allowing these people to live here, else they couldn't function. So when she says these things, it's disingenuous at best. You gotta be
Rodney, which things specifically do you think is disingenuous?
About what she says about she doesn't think that illegal immigrants are on these programs, SNAP and Medicare and stuff like that gives you aid so you can survive.
So hold your thought for a moment. I want to let Sophia respond to your characterization of her comments.
Rodney, thank you so much for the question, and I can hear the conviction in your voice about how important this is to you, and I understand that and really appreciate you raising the point. Look, I can't speak to the specifics of who you're interacting with in your community, but what I can tell you is what the federal law currently is, and it's that undocumented immigrants already are barred from accessing healthcare programs that are funded with federal dollars. That's already the law on the books. You have some states who are using their own state dollars to fill some of those holes. That's a state level decision. And you have folks who are here legally, who have lawful residency status because they're green card holders, or they have work visas, or they might be refugees or seeking asylum, all here lawfully present individuals that eventually, after 5 years of waiting, eventually could be eligible for some programs. And so those are the current rules on the books already, and this bill is trying to undo some of those provisions.
Did you have a follow-up question, Rodney?
Because you have 20 million people that need care, and the last administration allowed this to happen. You can build a house for one family and change it to have 4 families in there. So you can't sit there and just say that the laws are in the books. How do you expect to keep 20 million people in this country?
I see. So, Rodney, it seems like your point is that regardless of what the laws are, what's happening is that these folks are using these benefits. Nope, I think we lost Rodney there. Okay, well, let's go on to another caller. Sally is in Malvern, Pennsylvania, on our line for Democrats. Good morning, Sally.
I worked in the adult probation office in Pittsburgh for 24 years, and at the end, I felt very strongly that people who are in this population have so many burdens to bear that they have had no control over in their lives, and I do not think it's fair to place any additional burdens on them. I feel that if they can work, they usually do, and if they don't, it's because they can't.
Okay. Do you want to respond?
Thank you. Thank you very much, Sally. I think you make a really good point. I think it is a challenging. I think half of folks around the country don't have $400 or $500 in their bank accounts for emergencies, and so I think my experience is the same. That if folks can work, they are. And again, in these programs, we know that the vast majority of folks are working or have reasons under federal law that they can't be, and so they have an exemption from being able to work.
Next up is Mike in Montgomery, Alabama, on our line for Independence. Good morning, Mike.
Good morning. Thank you for taking my call, Kimberly. So earlier this year, the country witnessed the assassination of United Healthcare executive gunned down in the streets of New York City. It seems leaders of other large healthcare providers like Blue Cross, Anthem, Aetna have kept a low-key profile and limited their public appearances with just cause. Can your guest comment on this latest phenomenon in the country?
Thank you very much for the question. I think I want to just say, as an individual, I think any violence against anyone, particularly murder, is definitely not the path forward. I think there's that. I will say, I think this larger dynamic around people's deep frustration with the healthcare system. And healthcare costs are exorbitant. They're increasing every year. We know that the system is incredibly complicated. It's hard to navigate. And when people are able to navigate it, they're feeling like they're getting dropped through the cracks of the system, that they are not getting the call back, that they have to wait 6 months to see their primary care provider. The healthcare system does need important changes. It does need to be improved. The costs need to come down. And we know that voters in the November election told us that costs was their number one issue, including rising healthcare costs. And so there are solutions on the table that are bipartisan, that have been Republicans and Democrats alike that have championed and in the past Congress, and I think are still on the table for this Congress as well, to address some of those underlying issues of the healthcare system, to make it more efficient, to actually make it more efficient, to actually bring down the cost of care. But it's not forcing people off of healthcare coverage. It's not making them more economically vulnerable. It's about how do we make the system work better for everybody, and how do we bring down healthcare costs. And we know that forcing people off of healthcare coverage just increase healthcare costs for those individuals.
Another question about potential fraud, this one from Kent in Graham, Texas, who asks, how about Medicaid fraud is practiced by misuse of block grants and borrowed matching funds that are immediately repaid when the federal money is received? This question from Kent in Graham, Texas.
I'm not exactly sure I'm tracking the question, but I think that Medicaid is not a block grant program. It's funded through a federal and state partnership where the federal government, there's a technical formula that's used to help determine how much the federal government contributes and how much each state contributes. And that's the current funding structure under the Medicaid program right now.
Well, that is all the time that we have. Thank you so much, Sophia Tripoli, who is the Health Policy Senior Director at Families USA. We appreciate your time this morning.
Thank you very much to you.
And coming up next, we'll take more of your calls and comments in Open